You're listening to the Modern Healthcare Back Office, a podcast dedicated to solving the billing issues and gridlock facing the healthcare industry, presented by ProChant, hosted by Chuck Ellis and Rachel Schools.
Well, hey there, folks. Chuck here, and welcome to the Modern Healthcare Back Office. I am joined by my amazing co-host, Ms. Rachel Schools. Rachel, how you doing today?
I am awesome, Chuck. How are you?
I am also awesome. I am recovering from putting together a giant playground in my backyard for my 5-year-old who is currently out there swinging away on it. So Papa can record. He and Mama are out there. So it's doing its job.
Were you sore?
Which is, yeah, exactly.
Were you
So,
sore from putting that up, Chuck?
oh yeah.
Yeah.
That was, I was so sore I could up, Chuck. That's how sore I was.
Oh,
Joke never gets old, I tell you. So, well, folks are not here to listen to me talk about putting together a playground. We've got a even more, if it's possible, complicated matter to talk about today. That's why we've brought in our HME DME back office pro, Melissa Wagner. Melissa, how you doing today?
I'm well, Chuck. How are you?
I am also well. Thank you so much for being here because we've got a bit of hot news to talk about. This public health emergency thing from this thing, I believe it's called COVID, is coming to an end on May 11th. And yeah, it's of course changed the way just about everything in the world is done. I know Rachel and I have talked about how it's affected the way work is done in general and how lives are lived in general. But specifically, we wanted you to come on because, this is going to really shake a lot of people who were providing home-based care, HME, DME equipment stuff during the pandemic, because of course there was a lot of illness involved. So Melissa, let's start with what happens on May 11th and why should our listeners be really concerned about that date?
Good question. So, as we understand it today, what is expected to happen on May 11th is the official end of the public health emergency. Effectively means that any accommodations or change in guidelines or benefits or opportunities will effectively come to an end. And so, in our world, in the HME world, it means a couple of really important things. And that now that the PHE has been going on for some time, history is fading a little bit in terms of when this all started and what started happening and why it's so important to understand what's going to happen on May 11th. And that is default, the ending of the public health emergency. Some of the what we call the coverage waivers that were particularly put in place by Medicare to allow for access to home-based care, HME products that otherwise would not have been covered based on pre-COVID requirements. But because of access and ability for patients to get to doctor's offices, several things were accommodated, such as more telehealth visits and some waivers of coverage guidelines that otherwise patients would have had to qualify in order to get certain equipment. And that required some changes in software systems, et cetera, accommodate and advisement part of the billing process that these were specific patients that were provided products or equipment or services that would otherwise not have qualified. So effectively on May 11th, that comes to an end. What's more important is what happens now, 30 days, 60 days. And in terms of business days, May 11th is not that far off. And so there's certain information that we don't know today, right? And that is, so what happens, right? We know it's going to end, but there's really just rampant speculation at this point in terms of what does that mean? Will those patients that were provided care allowed to continue to get those same services? Will there be a period of time where they will expected to be qualified and then some end point where they will not longer allowed to be qualified? Or does just simply be a look back period where those patients who did receive services will continue to be allowed to receive those services, some specific billing guidelines so that we know who they are, but then going forward, patients would not qualify. So that's a revenue roller coaster, really, for a lot of providers who were able to capitalize on the opportunity to provide patients with certain products and services that may now not be able to, right? For maybe all the right reasons, but may now not be able to as of the change. So, but that's really the big elephant in the room is that we don't know what that is going to look like
so
or when we're going to be notified.
do you mind if I ask a question?
Go right ahead.
So we get the PHE expires, right? And we can no longer do this. What about all of the patients that already accepted into service. Like I'm
Mhm.
thinking HME, right? We've got patients on
Mhm.
concentrators and other things like that. Does that mean also, Melissa, that we have to go back and get those patients now qualified if they didn't qualify?
These are some things that we don't know yet.
Okay.
And yeah,
Okay.
yeah, yeah. To my knowledge, we don't know. We don't have those answers yet, and that's really the $64,000 question is when will we be getting that guidance, and what will that mean to patients who there are varying degrees of life sustaining capabilities of these services, products, and equipment, and so we really don't know yet. So we have a date. We know when it's going to end. We have some idea of what that might mean to some of the billing guidelines post 511.
So
But
if it were
go
you
ahead.
and you were deciding, Melissa, what to do, would you be proactively trying to identify these patients in your practice management system?
Yes.
Okay.
Yes.
And
Absolutely.
segment them in
Yes.
some way,
Yes.
maybe by product category
Yep.
or
And that
something?
is the
Mm.
recommendation, right? To your point, Rachel, that's a clear recommendation that get out in front of this because it is such a big unknown is to understand, particularly if you're a provider that has a cross section of products, maybe different requirements or different we just don't know if oxygen is going to have some one set of guidelines in terms of continuation and GMs or some other types of equipment might have a different set of continuation
Oh
guidelines. So
boy.
very important.
Oh boy.
Yeah.
Okay.
So that's another. It's just equally as concerning for a specialty provider, but you have a cross section. At least that's one set of guidelines that you manage to, and one patient population that you can manage to. But if again, if you're a provider that does a cross section of products, it may add a level of complexity for training, education, patient contact, and a level of anxiety this patient's going to have. Some may already be calling. There are patients out there that are savvy and are paying attention to what's going on in the news and may already be starting to ask some of these same questions. And unfortunately, we have some limited answers. But certainly from a business management standpoint, proactive communication, understanding what the impacts are going to be, so that as soon as the guidelines are provided, the providers or we as providers can act quickly and swiftly to make sure that there's little disruption and as limited amount of anxiety on the patient population as possible.
So the PHE, it that expires. We go back to whatever our coverage guidelines were previously, or if we have new ones, like in the event of oxygen, we go back to those guidelines, right?
I that may be the expectation, yes, is that guidelines were in effect prior to the implementation of the PHE would be the guidelines that would return. But it's still unclear what time frame or what type of sort of cascading of continuation of use of products, services, equipment either will be allowed or not allowed, whether there'll be a hard cutoff for strictly new patients or if there will be some sort of there's a word we used to use. I know nobody likes to use the word grandfathering anymore in the scheme of Medicare, but that's kind of what the term has been in the past for some level of transition, right? Of from a time perspective, from a process perspective, from a patient perspective.
Got it.
So what are some of like we've talked about some of the steps to get ready now. Like what is the worst case scenario if somebody isn't ready when May happens and they have not gotten their back office lined up, or
So most obvious repercussion is that they may continue to bill for services that they will not get paid for, right?
okay,
Because continuing under the premise that this patient fell under these guidelines in which there were coverage waivers. And since that waiver has effectively ended, that's the speculation that they would have denials and cash flow issues. Could become certainly a PR problem for the provider, right? They have
mm,
referral sources that they have to coordinate with, make sure that their referral sources also understand that there are changes and that the referral sources don't continue to or know not to continue to send patients to the provider that for patients that don't coverage guidelines. So beyond everything we talked about, is this other sort of community education process that the provider should also be being quite proactive about at this point in time. But the patients will suffer, right, if we're not
sure.
prepared because they will be under some false pretense potentially that they can either continue to get supplies they may not be qualified for, may see denials, and at the end of the day, the provider will suffer some potentially serious cash flow ramifications.
So I think the question then is like, so we've talked about this over and over again on the show. Teams are short staffed. People are doing what they can to get by. It's possible. I'm not saying that our listeners have done this, but it is possible that some of them are out there. They were taking advantage of these public health emergency guidelines, getting people signed up while they could, and figured they'd deal with it later. And they're, looking at this and going, oh no, it's later. So what do you do when you're completely short staffed, or you feel like you're still just so busy trying to keep the lights on, and now you have to go back through and piecemeal through all of these different patients and see who falls under these guidelines and who doesn't?
Yeah, so one of the things that we'll be very proactive about is making sure that we're effectively partnering and sharing in some of that educational knowledge and preparation with our client, help them through this process, right? We all share in some responsibility.
Mhm.
And so it's sort of discuss and engage often, intensely, make sure that no opportunity for knowledge or awareness of what's happening slips through the cracks, right? So, and there really shouldn't be any reason for that to happen. As we're partnering together, we're sharing in some of that responsibility from a communication standpoint to ensure that there is as little disruption to the clients and then therefore the patients, because that's what we're all here for,
Sure.
as possible. So we will certainly do everything we can to lead the horse. Really, people need to stay tuned, right?
Yeah. Okay.
They need to
So,
stay tuned to this as a
mhm.
matter of survival, really, because it could have some devastating consequences if a provider is not,
Yeah,
really taking
absolutely.
this
Yeah, I think
seriously in
that's,
terms of the time frame and the
yeah.
expected preparation time, and between anyone they're partnering with or even within their own software business systems. There's lots of
Mhm.
tools and opportunities to pull data, understand what the patient population impact is. And so if they're not doing it now, should be, and we're here to help partner with them on.
Where would we keep where would we stay tuned to? Who should we be following? Like GS or
Sure. So most everyone is at least somewhat in tuned to their three organizations that are providing information,
yes,
whether it's AA home care, state associations, their vendors, because everyone has a stake in this, right?
BGM?
CM partners, BGM, all the above, right? So there's no shortage of notification, knowledge, accessibility out there. So if it's not coming to someone, they should be seeking it out.
Okay. Well, stay tuned is, I think, the best thing that we can say at this point. We just want to make sure we're getting out in front and letting you know what we know and what the industry doesn't know, which it seems right now is a lot. So yeah, again, check out your local associations. Stay tuned here because we are going to be bringing up more about this as it develops, because this very much affects us and it very much affects all the wonderful people we work with. If our listeners have any questions about this issue and they want to talk to you directly, how do they do that, Melissa?
Melissa W. at prochant.com.
Absolutely. Well, very cool. Well, thank you so much, Melissa. We really appreciate you being on for this quick update. We had this come across our desks and we were like, oh, we got to talk about this. So again, thank you everyone so much for listening. If you're watching this on YouTube, please like the video, make sure you're subscribed, share it on your LinkedIn with your colleagues and your coworkers and friends. If you get the chance, that really helps spread the word about the show. And if you're listening to this on Apple Podcasts, please give us a 5-star rating. That really helps raise awareness of the show to folks in the industry that can benefit from what we got to say. As always, we want to thank you for joining us. On behalf of myself, Rachel, and the rest of the team here at ProChamp, we'll see you next time. Take care.
Thanks for listening to the Modern Healthcare Back Office, a presentation of ProChant, a wholly owned revenue cycle management service dedicated to serving HME, pharmacy infusion, and other healthcare providers. Learn more about us at prochant.com.